Get connected to immediate access, improved efficiency, and enhanced patient care. Get connected to a secure, comprehensive EMR system. Plug in to Deaconess Care Connect.
I've been using computers for years to take care of patients, but the problem I always had was there was always the need to go to paper to get the information that you needed to take good care of your patient. Now with Deaconess offering the Epic system, all of the information that the physician needs to take better, safer, more efficient care of their patient is in the same system.
Epic has really made it easier for me to see what's going on with my patients. Day to day I can see the notes. Day to day I can see the tests. I can see the results.
We do not have to wait for a chart to be pulled. We do not have to wait for someone to get back to us with information. We have the information that we need at our fingertips.
Let's say a phone call comes in and my staff opens up the chart, they put in a telephone encounter, then it goes straight into my in-basket for me to review instantly, and I can get a message back to them within minutes, and they're calling the patient with an answer.
That kind of efficiency is common with Epic. Still, many physicians worry that the switch from paper to an EMR will be difficult, but Epic users have found the transition to be surprisingly easy.
When I first heard that I was going to have to convert to electronic medical records, my first thoughts were I just simply was not going to do it because I thought it would be too hard and that my patient load would go extremely low. The other concern was being not a computer genius, how I would do compared with some of the younger physicians. And I actually felt like after 3 to 4 days I had most of the system mastered.
I think change is hard for anybody. So just going from a paper chart to putting everything in the computer system, I think causes a lot of anxiety.
My biggest concerns were, is this computer going to be like a third person in the room? Is the patient going to feel like I'm just putting data in the computer and the computer is spitting out the diagnosis? But actually, the patient-physician relationship has only been enhanced by Epic.
Physicians have found that entering patient information into a computer takes no more time than putting it to paper.
It is no different than what I used to do in the paper world. I had a piece of paper that had a bunch of check boxes on it. I had my diagnosis codes that I used. Now those diagnosis codes are saved within the patient's chart. I just use those, order the tests, do the appropriate associations that need to be done for the system in order for it to process it properly. And my time is no different on that.
In fact, the one patient, one record approach fostered by Deaconess Care Connect and Epic actually saves time.
Wherever that patient goes, the chart follows. I don't have to call the different offices. I don't have to, guess what medications the patient was given. All the information is right there in that chart at the time that I need it.
Once they understand that it's helping me take better care of them, they feel confident, they're reassured, and they're happy that they're with an Epic doctor.
Unlike other EMR systems, Epic allows you to adjust the software to fit your workflow.
I've picked out the things that have been good for me, but there's not a day goes by that I don't find a simpler way to do something. If I was buying a system, I would certainly want something that had all kinds of possibilities to it. And a lot of the other systems don't have the scope of what can be done with Epic.
Physicians can access any of their patients' information from anywhere that they have internet access, whether it be their office, home, even when they're on vacation.
If I really need to be somewhere shortly after office hours and my documentation is not complete, I can finish it without having to come back to the office.
There are even applications that allow you to access your records from mobile devices.
Well, the iPhone app is great because when I'm out and about, I can take a phone call and go straight to that patient's chart, order a medicine, and fax it off to their pharmacy with confidence that it's going to get there and the patient's going to get the care right away.
Epic also works with voice recognition software to speed up transcription and correspondence.
I use the Dragon voice recognition software for dictating. Prior to that, I was handwriting everything, and so I would really get behind if I had to see a lot of acute patients, but now I'm done with my documentation before I go home most business days.
Prescribing medication is also faster and safer using Epic.
I love e-prescribing because when the patient is in the office, it's already at the pharmacy by the time they get there. It saves the patient time and frustration, it saves us time.
If in the middle of the night I'm on call and I have to send something to the pharmacy, I can log into the computer. I don't have to call the pharmacist. I don't have to sit on hold. I just send it there and it's either in their computer system or sent by fax.
And switching to Epic is just the beginning. Epic is fully supported by Deaconess Care Connect, one of the largest healthcare systems in Indiana, to ensure smooth daily operation.
We have a team of people that support the EMR with affiliates. So a physician in their office who's not employed by the hospital can take advantage of the expertise of our team, not only to get their system up and going, but to help them with issues once they're live with the system.
The Care Connect team will work with your office to get the information from your paper charts into Epic so that you're not having to pull the paper chart and use Epic at the same time.
We have a phone number we can call. They have staff that come out regularly to ask questions, and if there's certain parts of the system we want updated or we want to get into, they're very good about explaining that.
There's no maintenance as far as I'm concerned. For example, we had a power surge with the storm and our computers went down. Well, as soon as they came back on, I had not lost a single bit of information.
Epic has been chosen by several of the care leaders in this country, not only Cleveland Clinic, but Kaiser Permanente, and I think that speaks volume for the quality of the product that they provide.
Physicians have an opportunity now that they're probably never going to get again. The government is giving all physicians up to $44,000, which in many cases is going to pay for the EMR plus pay for a lot of their hardware. The challenge with that is the EMR has to be in use by the physician of their practice in 2011 to get the full amount.
Epic is not just an electronic notebook. It's not just a place to write things down and keep them legible. Epic organizes, analyzes, and helps me take better care of my patients.
The more doctors that are on this EMR, the better we can take care of our community.
And patients appreciate that. They appreciate the fact that that information is there. They appreciate the fact that if they go to the emergency room, they're going to have that same chart that I see, that doctor's going to see, and vice versa.
Physicians ask me all the time why they should have an EMR. I tell them there's three main reasons. One is it's safer for the patient. Two, it can make you more efficient over time. And three, all the information about the patient is in one place.
Plug in your practice to the best EMR system today. Get connected to immediate access, improved efficiency, and enhanced patient care. Deaconess Care Connect. It's secure, integrated, comprehensive, and personalized to meet your needs. Make the call today. Deaconess Care Connect.